Today in the news, a Texas town removes a fence between white and black cemeteries, and studies show that most young virus cases in South Texas County were diagnosed this month, and the City of Dallas's hospital capacity report. Today is July 22nd, 2020, and this is Dallas Weekly News. Hello, I'm your host, Patrick Washington, and this is Dallas Weekly News. Another lingering relic of the Jim Crow era was being ripped from the ground this week in a small East Texas town. Municipal crews were digging up a fence between two adjacent but separate historically black and historically white cemeteries in Mineola, about 75 miles east of Dallas. The removal project began last Wednesday morning, and the ceremony was expected to last about 4 days, said David Collett, president of Cedars Memorial Garden, the cemetery historically reserved for the graves of white people. He said it was a very emotional moment. Pastor Demetrius Boyd of the predominantly black St. Paul Missionary Baptist Church in Mineola said that although removing the fence was the black community's desire for decades, he began working towards it since arriving in 2007. Boyd said he persuaded the Cedars board to allow an easement from the US 69 front gate to the city cemetery, which had been accessed only from an obscure entrance from a back road. The improved access to the black cemetery satisfied all parties, Boyd said, but early this month, the funeral and burial was held for an African-American former FBI agent and Marine that drew mourners from outside of Mineola area. That, combined with the social climate in the wake of the Minneapolis police slaying of George Floyd, ignited a push to ease lingering relics of white supremacy, such as the fence, Boyd said. Cedars was formerly known as the City of Mineola Cemetery, while the historically black cemetery is called City Cemetery. That created mistaken impression among public that the cemeteries were city-owned, and the segregation reflected badly on Mineola. That's where city manager Mercy Rushing and the city council came in. The council approved community development funds to send crews to remove the fence. Collett and Boyd both said the next step would make two cemeteries one by a merger or creation of a single organization to look after both. Annette Rodriguez, the Corpus Christi Nueces County Public Health Director, told the Associated Press by phone most of the 85 young children in the South Texas County who were known to have contracted coronavirus tested positive this month amid a surge in the state. Nearly all of the children, most of whom are 1 year old or younger, are expected to recover on their own. She said one of the children died, but officials still trying to determine if COVID-19 was the cause. The county, which is home to about 362,000 people and sits in the Gulf Coast, is one of several COVID-19 hotspots in Texas, which has been hammered by disease in recent weeks. On Sunday, Governor Greg Abbott announced that Department of Defense had sent 5 teams of Navy doctors to 4 locations in southern and southwestern Texas to help hospitals where capacity has become stretched. Texas health officials reported 7,300 now confirmed cases on Sunday and said 93 more people have died due to COVID-19, the disease caused by the virus, bringing the number of reported cases to 325,030 and the number of deaths to 3,958. The state reported 10,592 individuals who were hospitalized with the virus on Sunday. Rodriguez said during a public health update on Friday that 85 infants in Nueces County had tested positive, though she clarified Sunday that some of the kids were not infants, some up to 1 year old and others were as old as 23 months. Her Friday claim prompted Nueces County's top elected official, Judge Barbara Canales, to issue a statement Saturday saying that 85 figure reflected the cumulative total since mid-March. But Rodriguez stressed Sunday that although the oldest of the cases goes back to mid-March, most of them, 60 infants, tested positive from July 1st to July 16th. Rodriguez said that the child who died was less than half a year old and tested positive this month. The child was hospitalized and released before dying at home of what officials first believed was sudden infant death syndrome. Officials are now awaiting lab results to determine if the virus was a factor in the death. 9 of the other children were also hospitalized but have since been released. The first young child from Nueces County was hospitalized in mid-June. One of the infants who tested positive is a recent newborn whose mother also has the virus. Experts in pediatrics and infectious diseases say there are still many unanswered questions about how COVID-19 affects children. Several studies suggest but do not prove that children are less likely to become infected than adults and more likely to have only mild symptoms. According to the Center for Disease Control and Prevention, 1.5% of the confirmed cases in the U.S. have been children 4 years old or younger, while 0.2% of the country's COVID-19 deaths have been kids from that age group. For most people, the coronavirus causes mild or moderate symptoms that clear up within weeks, but for others, especially older adults and people with existing health problems, the highly contagious virus can cause severe symptoms and be fatal. Judge Barbara Canales said that the increasing number of positive tests in younger children in Nueces County is due in part to aggressive testing by the county, especially of family members who live and work in high-risk situations, including senior care centers, jails, group homes, and halfway houses and meatpacking plants. Rodriguez said that although increased testing is part of the reason the disease is being found in Nueces County, kids more frequently, she thinks the main reason is the dramatic rise in cases in the county, particularly this month. And now the City of Dallas's hospital capacity report. Thank you for joining us. This has been Dallas Weekly News. I am your host, Patrick Washington. You can find these and more stories at dallasweekly.com. And of course, follow us on social media on Facebook, Instagram, YouTube, and Twitter. And as always, please, if you can, stay home, stay safe, and we will see you again tomorrow.